Good morning, guys. We got some cool stuff for you today. Trev, SmashweRx, you know the routine. And one day I'm not gonna say it, you guys are gonna be all confused. We're gonna be talking about femoral nerve entrapment. I got a bunch of guys from you, or I got a bunch of messages from you guys on Instagram. Thank you, by the way. Keep sending me stuff. I'll gladly answer your questions as best I can, throw out a video for you and get you guys all cleared out. Save you a trip to the doctor. But femoral nerve entrapment, super uncomfortable, really painful. It causes like numbness down the leg, pain up in the side of the hip. I'll get up here, so I realize I'm always too damn close to this camera. So we're gonna have pain up inside the hip, pain down the leg, pain in the knee, numbness, tingling. You can get pain back here. That nerve travels all over the place. The branches, or the branch that comes off the spine, passes through the iliacus and the psoas. So it's got to pass right through those muscles and then get to all the structures of the leg and the hip and the lower leg and into all the tissues and everything that's down below the waist. So the problem is that when it gets stuck in that tissue, imagine a pair of scissors and the nerve sitting between the scissors and those scissors clamping down on a nerve, or a set of pliers clamping down on that nerve. That can't go anywhere, and it's going to choke off that nerve. It's going to cause a ton of pain, ton of discomfort, and then your body's going to react by causing inflammation, swelling, dysfunction, turning off the ability to, you get where I'm going with this, right? It basically turns into a whole mess of really, really bad. So I'm going to show you how to get rid of that. There's lots of ways, lots of things you can call this, and you can tell it's early in the morning. I haven't had my coffee yet. I'm all but what happens is, the best thing you can do is you can call it femoral nerve flossing. You can call it, release, nerve release, entrapment release. It doesn't matter. What you're basically doing is you're freeing up the body to do what it's supposed to do. So first thing we're going to do is we're going to peel it away from that iliopsoas complex. So the iliopsoas, remember, iliacus and psoas smashed together. Sorry about the chalk. Did a workout this morning, covered in chalk. And then we're going to peel away that rectus femoris. Now the other thing is that rectus femoris runs right down the front of the leg, comes off the ASIS, so the anterior superior iliac spine, goes all the way basically to this tibial tuberosity, and it's a hip flexor and a knee and a lower leg extensor, a knee extensor. So the problem is that it's also going to affect that hip. And when we're talking about the iliacus and the psoas, now the iliacus goes all the way from the L2 to L5, so the lumbar vertebra, all the way to the inside of the femur, but the iliacus comes off the front of the pelvis. So now that, remember, they do a lot of the same things. That iliacus comes off the pelvis, so if the pelvis isn't working right, it doesn't matter what we do because that's going to affect everything else. So we need to peel away that rectus femoris too. I know that's a lot of fancy terms. Basically, the muscle in the front, on the outside of the body, is affecting the muscles on the front in the inside of the body. That simple. Let's make it simple. Too many fancy terms. So we're going to use a peanut, trap the belly of that rectus femoris in there, and then we're just going to saw it. Just peel it open. We're going to rip it apart like celery. One of my friends said that, she laughed and said it was hilarious that he used the word celery because it's like peeling it apart. So that's what we're going to do. So first thing we're going to do is we're going to actually load it up. So remember, we want to put what's called a little bit of a load on the muscles, so we have to activate everything so things turn off, because it's called reciprocal inhibition. One works, the other one turns off. It's just that easy. So one side works, the other side turns off. So what you see here is I got a band. Let's dump this down here just a little bit. I know, mad camera skills, right? Mad camera skills. There we go. So check it out. I've got this band here. Okay, we're gonna do a little bit of fancy footwork here. We're gonna face this way. What we're gonna do is we're gonna take the band. So I want you to watch my foot. We're gonna take the band, put it around the foot. We're gonna loop it. So let me get out of the way here. So we're gonna put my foot in the band. Okay, foot's in the band. We're gonna loop it around. And then we're gonna turn the foot. And we're going to get it all the way around. So now I've wrapped my foot completely in the band. It's actually made a loop around my leg. So you can see that. And then I'm going to turn around. So now, my music's friggin' awesome in the morning, by the way. There's two ways we're going to do this. One with the baseball and the pad, and one without. We're facing the rig. So I've got a good firm loop here with a band loaded up. It's double looped around here, so it can't go anywhere. It can't roll up my leg. Well, at least not that much. So if it does it on camera, I'm sorry. So now what we're gonna do is we're gonna make sure we keep that band so it does roll up the leg. And we're just gonna take the knee and we're gonna do this. So you can see I've loaded it up. So now this band, twang, it's like a guitar string. Okay, now we're gonna load up that iliacus and that psoas. I haven't even used this yet. Notice I'm still clutching the peanut. So we've got the band loaded up, and all we're gonna do is prop ourselves up like this, and we're just gonna lightly contract and relax that rectus femoris while squeezing your glutes. So if you look at my butt. You guys love it when I say that. So get yourself up like this. The band has got, you can load up the band as much as you want just by pulling away from the ring. So load up the band. The band is forcing your leg into flexion. Prop yourself up so it loads up that iliacus and that psoas, and then just floss back and forth. Okay? You know what helps? Tuck your chin. So you tuck your chin. Go ahead and loosen that up. That's number one. Number two, take the ab mat, toss it under here. Take a baseball, big old softball, Craig Howard softball. Thanks, Craig. And you're gonna put it right in the pocket, right beside the belly button. So go out about an inch to the side of the belly button. And then just, oh, that's horrible. Holy moly. Oh. So you're gonna put that baseball in there. So baseball in here, an inch to the side of the belly button, on the ab mat, roll on it, and then just take it through ranges of motion. And just peel apart that rectus, or that iliacus and that psoas. I can't even talk straight, it hurts so bad. That iliacus and that psoas, freeing up that femoral nerve. Oh. All right, I gotta get the hell off this thing. That's number two. Get this thing out of here. Number three is, it's like I just want to lay here on the baseball. It's almost that comfortable, it hurts that bad. You can tell I need to floss a little bit, huh? So you're gonna take the peanut, you're gonna roll on your side, you're gonna put the peanut, that rectus femoris runs right down the center of the leg. It's that piece of beef jerky that you feel, not supposed to be there. You're gonna take that. Whoa! God, that hurts. This is abysmal. Now the peanut's on that rectus femoris, you can see it there, trapping the entire belly of the muscle, and then you're just gonna crank down away on it. Use the baseball as a prop for your head because it hurts that bad. And just floss away. Grind that thing into supplitude. I used the word yesterday. It's a word, Webster's Abridged. Check, it'll be out, courtesy of Trevor. And just grind away on it. You're gonna work your way all the way down. So just keep moving that peanut all the way down. Keep that leg loaded with that band. This way it keeps tension on that leg, and it forces you, and don't let this thing snap all over the place. It forces you to keep that leg loaded, all right? And when you're done, get the hell out of this band because it friggin' hurts. All right, so what that's gonna do is that's gonna free up everything in here. Here, let me move the camera again so you guys aren't, oh, camera mishaps, so you guys aren't staring at my, my feet. Okay, so what that's gonna do, that's gonna open up the pocket. It's gonna allow that nerve to pass through that tissue properly and control all those structures. Take all that pain away, honestly. Get all that discomfort away, get that numbness gone, and take away that knee pain, that thigh pain, that hip pain, especially when you're driving, or a lot of you guys that sit for your job or drive or tend to just sit anyway. Don't sit, get up, move. You know the rule, right? Movement is your friend. Emotion comes from motion. So to feel good, you gotta move. You can write that down. Anyway, so that's how you free up that femoral nerve. This one's for you, you know the one. This is Trev, SmashweRx. Talk to you guys tomorrow. Have an awesome day.